I'm Wendy Garner for Children's of Alabama. It's been a tough few months already with COVID-19, but now we're entering flu season. Join me right now is Delphine Nolan, who is the manager of infection prevention and control here at Children's. It's so good to see you.
Thank you. Thank you for inviting me.
Absolutely. We're trying to stay socially distanced right now so that we can do this, but it has been a scary time.
Yes.
But now we're entering the cold, flu, and RSV season. What are your concerns?
I think my biggest concern is that people do not become lax and forget that flu is a real threat to our community, and that we still go out and vaccinate like we've done in the past to get that percentage up, because we want to make sure that whatever we can do to mitigate COVID-19, we want to, if we can decrease the incidence of other diseases.
So hopefully the continued hand washing and wearing the masks and socially distance can help with the flu season, but obviously, as we're seeing with the COVID cases, it's not necessarily enough, is it?
Correct. I think we have seen a decrease, which is great, which tells us the masking works. We know kids are going back to school. We know that this is cough and flu season every year. So we want to make sure that we are doing everything we need to do to prevent those also.
That's right, but that's why it's so important this year, especially for people to get their flu shots.
Yes, it is utmost important to get your flu shots. I do know they're already available, so you can go ahead and make it a family event and take everybody and be vaccinated for the flu.
Okay, tell us the difference, if you would, between the symptoms of COVID-19 and the flu.
And that's part of the problem, because they are so similar, because both of them are viruses. So one of the things is loss of taste and smell is hallmark COVID-19. Shortness of breath, initially, usually shortness of breath for flu is later in your disease process for pneumonia, but shortness of breath sometimes happens pretty quickly when you have COVID-19.
Okay.
A lot of the other symptoms are so very similar, which that's what gives us that pause of how are we going to be able to tell which is which when they are so very similar.
Which is the cough, the
runny nose, sore throat, fatigue, fever, nausea, vomiting, poor feeding of babies. All of those are pretty much interchangeably when you talk about COVID-19 and flu.
So because of that confusion, the way they sort of overlay upon each other with the symptoms, that's even more reason for us to socially distance, wash our hands, wear our masks, and get the flu shot.
Get the flu shot.
All right. And if people have questions or concerns about their own child, they should contact their pediatrician.
Correct. Yes. Your pediatrician is your source of truth.
Okay. All right. Thank you so much, Delphine Nolan,
welcome.
for joining us. We appreciate it. And if you'd like more information on this or other health and safety related topics, just go to our website, childrensal.org.